Hi, this is Dr. John Corey in Scottsdale, Arizona. We're going to talk today about rippling because you hear a lot about this on the web and people talk about it all the time. So I want to just mention a few things about it and the different types of implants as well. Rippling is caused by just a wrinkle in the implant. And really, essentially, almost all implants can ripple. No implant is ripple-free. It's just a ripple or a little wrinkle in the side of the implant. So none of them are ripple-free. They all have a tendency to do that. But there are things that you can do to get away with that. Putting them under the muscle helps a lot. If you have a lot of breast tissue, that helps a lot. But they're all inherently have that ability. Let's look at a couple implants. I have three right here. I could juggle. If I could juggle, I would juggle with these. This is a saline implant. I know saline implants look really bad when they're out of the body. They're not as bad as this, but you notice they're a little wiggly and a little jiggly, and that you can see the wrinkles in the crease, the wrinkles in the implant itself. That can be seen through the skin in some patients. So if you're very thin, very lean, have very little breast tissue, you might want to maybe stay away from a saline implant. Okay, let's throw that over there. Next is a silicone implant, and you can see this is the workhorse of implants. This is the one we probably use the most often, but you can notice that in some positions, it actually has a little bit of wrinkling or rippling in it. And again, in a thin woman, even this can be seen through it. Ripples less, but it's not ripple-free. But again, even a regular silicone implant, this is a style 15, this is an Allergan implant. It's a mid-range profile implant, and this one is 371. But you can see that even a silicone implant can get some rippling. This, threw that over there, this is the new teardrop implant. This is called the 410. This is an Allergan type, and it has a little bit more of a teardrop shape. Notice that when I hold it up, you don't see as many ripples or wrinkles in it. There's still a few, but you just don't see them. You also notice that it has a teardrop shape, and they make it in different profiles, meaning it can be a little more full in the top, it can be a little less full in the top, depending on what the goal is for the woman and what she likes. So again, that just shows how rippling happens. Can it happen in anyone? Yeah, it can, but most of the time when the implant's under the muscle and under good breast tissue, it's just not a problem. You don't even see it. So, and it can be a little bit of a hard problem to fix too, but that's the quick and dirty on rippling. This is John Corey in Scottsdale, Arizona. Thanks.